Yeah, thanks, Sally, and thank you for the opportunity for presenting our Campus for Ageing and Vitality, or the project soon to be known as something different from Campus of Ageing and Vitality here at Newcastle. As you mentioned, I'm Ian Garfield, I'm Director of Estates and Facilities, and here today with me is Robin Beattie, our Development Manager, and David Dent, who's our Business Development Consultant, who's been working with us throughout the duration of the CAD project. So just a quick overview of the site. That's how it used to be back in the 1800s, and how we would love it to be now, but unfortunately it's not like that. It's had quite a checkered history. You'll see on the previous slide, in the bottom left-hand corner of the screen, the original workhouse that was developed on the site, and then from that subsequently has developed the infirmary on the site, and later referred to as the General Hospital. And that's the site that we acquired back in March of 2019. And you can see the site there on the aerial Google view, and its location on the right-hand side of the screen, and its adjacency to the city centre, which is highlighted with the salmon pink circle, the university in yellow, and the RVI in the sort of darker purple above it. And that's pretty much as the site is at the moment, with some elements of the site cleared, and that's a slightly old Google image. It has the workhouse still in place in the bottom right-hand corner of the red highlighted area, but that has now been demolished. So the whole of that south side of the site is now cleared, along with the majority of the west side of the site, which you can see in the sort of paler colours there, towards the terrace housing on the west side. So the site itself is a 29-acre site, and that includes the Brighton Grove area of the site, which we didn't acquire. The trust retained that originally for the creation of a integrated health and wellbeing hub, but we're working with them at the moment on the possibility of integrating that into the site. So there potentially may be a bit of a land swap going on with regards to the ownership of that particular element of the site. We've been working with partners within the City Council, and the two health trusts, along with the CCG, to develop the ambition for the site. And I'll show you shortly the vision that resulted from that. But basically, what the purpose of the site is to develop a sort of multidisciplinary site, a multi-use site of research, business activity, and intergenerational living that will help us work towards our vision. And we've worked long and hard on the vision, and the vision is effectively a document of many pages, but we decided it would be useful if we could have a vision on a page. And you can see there at the top the vision writ large in many words, but the key elements you'll see below are health, wealth and well-being, to promote the idea of this healthy ageing agenda, but with cross-cutting themes running across all of those areas around workforce and career development, because obviously the site will create employment opportunities, community engagement, which is absolutely crucial to ensuring the site isn't a ghetto, that it's embedded within the community and the community is embedded within the site. And then clearly the site is desperately in need of regeneration. But cross-cutting through all of this is what we refer to as the golden thread, which is why it's highlighted in a different colour, of research and innovation. It's our expertise in healthy ageing, our research expertise in healthy ageing, that really drove our desire to acquire the site and make the site the world-leading exemplar that we're hoping it will end up being as we start to develop the site out. So we realised very early in the process that we couldn't deliver this site on our own. that there were many facets to it. So we set about tendering for a principal development partner, and at the beginning of this year we selected Generate Kojima as our development partner. We also submitted our master plan. The site is covered by the local development and allocation plan, and it has its own policy. And key to one of the key conditions of that policy is that we must have an outline master plan for the site before any development can take place. So that was submitted again at the beginning of this year in March time, and that's been granted minded to approve, with further work still to do, both on refining that master plan, but on working with the planners to work out the various conditions that came with that planning application. We've been working closely with the City Council and Norfolk Tyne Combined Authority to look at potential government funding opportunities. That was prior to what's happened over the last few weeks, so they may not be as forthcoming as we'd hoped. But we're also working with organisations like HousingLIN, but also we've just submitted a funding bid into the Research Council for a research partnership investment fund bid, and the expression of interest just went in earlier this month. So this slide I'm just really going to scan over, really is just to sort of emphasise that internally within the university, it's not just about our expertise in health and ageing research. It's a multifaceted approach across the university. The biology obviously being mainly our Faculty of Medical Sciences, but the key really to the success of this site is those two middle blocks, the people and the community. As I said before, we need to ensure that the site is integrated with the local community, but the local community integrates with the site. So in the development of the site, obviously it's going to take a while to get the site developed out. So we're looking at things like meanwhile uses to make it viable and useful for the local community to interact with the site. But also in the development of the site, developing things like the integrated health hub and facilities like retail and leisure facilities that the local community can integrate with. So the community engagement really started as part of the master planning process, which is obviously a key element to submitting a planning application. But we've taken that a stage further by appointing an organisation called Urban Foresight, who've been working closely with us and our university engagement team to engage with the local community, the local ward councillors, and the wider city, to ensure that the regeneration of the site is helpful and supportive of the local community. And as I mentioned there, looking at meanwhile uses to make sure that that engagement isn't just at the start and at the end, but right the way throughout the process. So as I mentioned, the site's a multi-use site. There are existing university facilities on the site, and the name Campus for Ageing and Vitality came from the existing university facilities that were on the site when it was a general hospital site. So the university research facilities were developed in the sort of early 2000s, and that element of the site was therefore named Campus for Ageing and Vitality, campus relating obviously to the university activities. For some reason unbeknown to us, the whole site has now been deemed Campus for Ageing and Vitality, as has the local bus stop. And we're not quite sure why that happened, but we're keen to rebrand the site and rename the site, because as well on the site we're looking for private residences, both rented and purchased, for multi-generational living, because whilst the site is focused on developing healthy ageing, it's not about being a retirement village somewhere where It's purely an elderly site. It's there to have multi-generational living, because the research that's been undertaken and the exemplar site visits we've undertaken have clearly shown how that intergenerational living really benefits those in the ageing communities. Again, developing that healthy ageing, the research that the university does can only really be of any benefit if it develops into something, into products, facilities, activities, nutritional advice that can be developed commercially and rolled out within the site, across the city, across the region, nationally and internationally. So we'll be working with commercial partners and health service partners to develop those benefits for healthy ageing way beyond what the university research can provide. So as I mentioned, we've developed and submitted an outline master plan application, and that's the image that you can see on the left-hand side of the screen. But as we've brought Generate Kojima on board and we've started to develop the phasing for the site, but also the integration of the site with the local community, you can see we've started to adapt the master plan slightly, to take advantage of that cleared site and development of those early phases, but also looking at the public realm area that we had originally in the centre of the site, and how that is a single large public realm area that maybe doesn't help us bleed into the community. So what we've looked at is redistributing that public realm across the site, rather than having one large public park in the middle, to redistribute that public realm. So you can see, particularly down the east and the west side of the site, I don't know whether Robin's mouse will work here. Yeah, down that east side there and the west side of the site, you can see there that we're breaking down the physical barriers and trying to integrate the site with the local community. At the moment, the site is very much barriered off from the local community. There's actually a physical wall that surrounds the whole of the site, which really sort of distinguishes it from the community, and we're trying to integrate it with the community. So the intention is to break down those walls, but also on the east side, there's a significant height difference between the local community and the site itself. A drop of it varies from at the north end of the site, it's virtually level, to the south end of the site, it's virtually level, but in the middle, it grades up to about a 3 metre height differential. So you can see there that what we're looking to try and do is terrace that area to grade it back into the local community. And that's it there in sort of more sort of speculative image perspective. And there, how with on the left-hand side, you can see that bleeding, that breakthrough into the local community, and how that, for all we've broken down that large park area, you can still see large green areas on the site. And in the bottom right-hand image, on the right-hand side of the screen, you can see their potential meanwhile uses with some sports pitches or sort of active circuit areas to enable the local community to integrate with the site. So taking us to the next step, really, with that sort of first phase that we've said that we can start to develop. The purple area is the area that's obviously clearly still occupied by existing buildings, whereas the blue and the green areas have been cleared. So the blue area in particular is where we're targeting our first phase development. And plot 1 is a facility that we put the RPIF bid in, and I'll come back to that in a second. On the right-hand side, you'll see the orange line with the arrow on is the effectively the transport loop, the vehicular route around the site, because we're trying to keep the site largely vehicle-free, pedestrian-friendly. So plot 3 on that site is a transport hub which will integrate things like bus stops, cycle parking, cycle lockers and cycle changing facilities, as well as obviously car parking facilities and electric vehicle charging. Plots 2 and 4 would be the first residential developments on the site. And as I say, I'll come on to plot 1 in a second. So we've been working with the City Council and Legal and General on the Helix site for a number of years, and learning from lessons from the Helix site. One key lesson we've learned is there isn't actually a front door to the Helix site. So if you were to go to an event or an activity at Helix and weren't quite sure which of the buildings to go to, there isn't anywhere where you can go and ask directions. There isn't a front door, and there isn't really a key sort of focal point on that site. So an important and integral part of that plot 1 is to develop a gateway building and a gateway entrance to the site, so that anybody arriving at the site, and we've chosen the south side because Westgate Road is the key arterial road into and out of the city. So if you're travelling by train, you would travel up Westgate Road probably in a taxi. If you're travelling from the airport, again, you would travel down Westgate Road in a taxi. If you're arriving by car, you would arrive up Westgate Road and arrive at the transport hub. So that plot 1 is really a key front door, focal point, gateway to the site. So we've submitted this RPIP bid, Research Partnership Investment Fund bid, to develop the first site, the first plot on the building, as an integrated university, health, community and commercial facility, not dissimilar in many respects to our Catalyst building, where the National Innovation Centre for Ageing, National Innovation Centre for Data are working alongside the Voice, which is the public partnership into the elderly community and public community, but also commercial partners who want to work alongside Nick A and Nick D within the same building. So we're looking that the facility would be largely around that, but introducing more community, health, leisure, and digital data. Sort of, it's classed as health everywhere. Is it health everywhere or health anywhere?
Care everywhere.
Care everywhere. So that the digital element of healthcare can be introduced into that initial plot. And as I say, plots 2 and 4, and again, these are just speculative images of how the site potentially could be massed, but around that sort of intergenerational living with some potential retail facilities within those elements, a bit of co-living, and obviously starting that residential activity commencing on the site at an early stage. And as I mentioned, that's the transport hub, which would be, as I say, a multi-vehicular transport hub. And this is just some speculative images of how that south elevation might look, with the gateway building on the left-hand side in that sort of orangey yellow colour, and then the residential developments you can see there in the sort of greener colours on the right-hand side, with that entrance plaza to the centre with the public shown there. Over to you, David.
Thank you. Good afternoon, everyone. Before I share with you where we are with later living, I think it's really important we share I set some context. I know Ian's been over this already, but the vision is so important for this development. It's important to later living to the wider development as a whole, and that is simply to help people live longer and crucially healthier lives. Living longer is the easy bit, I guess. We all know we live in longer, but the extended years, the quality of life isn't that great. And the pillars of this vision is to improve the health, wealth and well-being of people of all ages, not just people in their old ages, people of all ages. And that's underpinned by objectives around workforce development. There's huge opportunities to upskill our care workforce on CAV. That's something we're really excited to explore in further detail and cope with the demands of an aging population, and in so doing, alleviate some of the burden on the adult social care budgets. Community, as Ian's alluded to, is really important. We want to bring the community with us. We want to open up the site to the community. And there's huge opportunities for community in terms of workplace opportunities, volunteering opportunities, that just sense of community, and to relieve some of the social isolation issues. And if we do that, we can regenerate a part of the city which currently has its challenges, but also offers huge opportunities. And the golden thread of all of this, as Ian's alluded to elsewhere in this presentation, is what makes HAPPI unique, in my opinion, is leveraging the universities and the National Innovation Centres region internationally renowned research programmes. And this vision and these objectives we've unveiled in every engagement session we've had with later living providers and with principal development partners. And in the context of later living, if we achieve some of these values, we've got a huge opportunity to provide something special across the whole spectrum of independence. Next slide, please. So in terms of market research, myself and Robin, we've worked across this for 3 years, I guess, Robin, I think it is.
Yep.
We've been privileged to meet some fascinating people and had the privilege of visiting some exemplar schemes in the UK and Europe. So what's our findings to date? Well, certainly a mix of accommodation solutions in terms of later living mix. We don't just see it as being a monolithic extra care block. We see it being a mix of extra care, retirement living, some really good examples of co-housing. We want to introduce that, explore how we can introduce co-housing, some Tyneside flats and general needs accommodation. So we're covering people in the later living context across the whole spectrum of independence. And they've got the benefit of complementary uses as well, using the scale and the vitality of CAV to, have leisure facilities, health facilities, community facilities, research facilities, and emphasis on the public realm. We see it in a mid-market offer. By that I mean, we're conscious of the fact that still the market economy is probably the fastest growing economy in the UK and in the wider world. So what we want to do is, but I guess what we've got at the moment in time is a polarization of the marketplace. You've got products for high net worth individuals, and you've got affordable products for people who are essentially on benefit. And we've been exploring with some of our engagement sessions and with the local authority really early days about how we could offer a mid-market offer. And if we can do that, then we can capture a whole new later living dynamic, which would be private rent, part buy, but also cater for people on more modest means and affordable rent and social rent. So that's something we found out in our research, something we'll look to take forward further in our discussions. We've also seen some great examples of partnership working with the public sector and the private sector. We've seen examples of, we've seen examples where the public sector local authorities provide demand confidence with nomination rights. We've seen examples of NHS trusts taking space in leisure centres, offering strength and balancing exercises to promote and the preventive care agenda. And we've seen block contracts for step-down accommodation in extra care facilities. And that's something we want to explore in further detail. Intergenerational living is absolutely essential, I would suggest. We've witnessed in this extreme, we're privileged, myself and Robin were privileged to go to Humanitas in Holland, the world-renowned sort of nursing home where students live amongst the older people. We knew we were going to see that. We knew that was on the tin. What we didn't understand we would see is people with learning disabilities living in bungalows adjacent to the nursing home who volunteered and provided activities for providing support to the nursing home people and the nursing home staff. And the benefits we saw for those individuals in reducing their level of psychotic drugs and their general existence in society was quite profound, really. And what we also didn't realise was there'd be care-related businesses taking up space in that one nursing home. So when you looked at the outside, it was a common garden nursing home. Inside, it was nothing but that, There was so much vibrancy and vitality in that space. And that's something we want to, and in CAV, we've got a unique opportunity to create that richness and vibrancy. We've got up to 1,000 homes planned on that development for people of all ages. We've got leisure facilities, we've community facilities, an emphasis on the public realm and university presence. So we can provide people with that ability to age in place of all ages. Technology, of course, is key as well. So we're exploring systems such as the Apello Smart Living Solutions and innovations that our sister company, Voice UK, trialing. Technology-enabled care will be embedded in the briefs to help reduce social isolation and stimulate a sense of community, I guess. Lifelong learning, seen some great examples in America, LaSalle's University, where in order to acquire a home or rent a home, you've got to sign up to a university course, 400 hours. And if you don't sign up, you don't get a home. And I think there's something in that stimulus in later life is so important, and that's something I want to explore in further detail. Extra care facilities being used by the wider community as well. Cafes, bistros, assisted bathrooms, evolving into community spas. And again, we've seen some great examples where such facilities are part of the fabric of the community. And the last bullet point, I guess, is a people-centered design brief. I suggest that's absolutely essential, that we listen to what people have to say and design what they want and not what they think what they want. Next slide, please. So research, obviously the golden thread of our vision. There's programs around the urban test bed, which focus on people and community, and that's about taking research into the community, into people's homes. The later living partner, there will be a land transaction, of course, but also there'll be a research agreement. And we've had discussions in our engagement sessions, and all of the partners are on board with this. And it's crucial they are on board, and obviously we can't force their people, their tenants, or the people who have bought their homes to sign up to this. All we can do is suggest they try to get them to sign up to it. And that can take that research to the later living development on CAV, to the wider CAV facility, into the wider community, but also into our later living partners communities as well. Next slide, please. So building upon strong foundations, HousingLIN in the world. Again, I felt, and Robin, I know, shares this view, we were privileged to go to HousingLIN, the world-renowned Dutch Dementia Village, which was inspirational. But also, our research, we've gained tremendous insights from other visitors from Europe and other places in the UK. And desktop, our research has been worldwide into Japan, Asia, the Americas, Europe, UK. So I think we've got a good place to come up with a brief, which is going to create something really special. And part of that brief will be a mid-market offer, which we explore in further detail with our local authority partner and with prospective later living providers. And demand. We've got to come up with something which is viable. In early discussions with partners and prospective partners in the local authority, we think there's demand for up to 150 later living homes, but that will be tested over the coming months because we want to bring something to the market which is viable and feasible. And what we also want to do is capture the later living client base within our research programs. And some of our potential partners, we haven't lost sight of the fact they've got access to people in thousands of homes. And today is a good example of how we're promoting later living on CAV to a wider audience and we'll answer your questions, hopefully get some insights for you in terms of what can go on in our brief moving forward. So my last slide, next steps. Next slide, please, Robert. So next steps, we set up a working group. That's a cross-organisational working group chaired by Ian, with representation from academics within the university, of course, from esteemed colleagues in Northumberland University, from the City Council, obviously, from the Health Trust, and also our JV partner. Because it's essential that this piece of work doesn't go off in splendid isolation from the rest of the JV. And their brief, I guess, is to help develop the brief and confirm demand. Homes England, regular dialogue with Homes England, was a meeting with them this morning on a regional level, but we now establish relationships at a national level. And we're exploring, in the early days, we're exploring forward-thinking later living innovations and products with them. The master plan as a whole provides the opportunity to create vibrancy and richness of offer. So we're working closely with the JV partner to see how the development zones evolve and what the best plot is for later living and how later living can complement the overall master plan. And research agreements, again, part of the brief for the working group is to develop a brief for research agreements, which is absolutely essential. And engagement, we've been engaging with potential partners for a good couple of years. That engagement's probably come to a close. There's a couple of sessions planned in December and hopefully some sessions early in the new year. And then we go, our timeline, a broad timeline is to go out to tender in the spring, have a competitive dialogue with the small C, and appoint a preferred living partner, emphasis on the word partner, in the summer of 23. Thank you. That's it.
There we go. Thank you, Ian, Robin and David, for that very informative presentation. And I'm sure there's lots more to unpack here, which we'd usually have Jeremy here to do so, but I think we're experiencing some technical problems still. But I see we've got some questions in the Q&A box, so if we work through those. Okay, so the first one from Alison: how will you confirm demand for affordable affordable homes as part of your next steps? This is just, I think, generally to the three of you.
I'll start with this. Is that okay, Robin? I think we've got to confirm affordable. I guess the question back is that affordable housing in the context of a general needs housing or in the context of affordable later living? Anyway, I'll take it anyway. There's Section 106 contributions which apply to general needs accommodation across the site. That will be one of the Section 106 obligations. That's how, what's that percentage, Robin? 15%. In regards to later living, it's unfettered by Section 106 obligations. But we're mindful of the fact what we want to do is create some demand, and this is one of the key functions of the working group, is to prove the demand for not only affordable housing or social rent, but also for a mid-market offer. And that's working closely with the local authority to test out that demand and see what that demand holds. Anything to add, Robin?
In terms of the rest of the residential development, we've appointed Avison Young, who have carried out a market demand analysis of the area, and they're ongoing with that at the moment. We've had the initial findings, which is informing our discussions with HousingLIN. But they're just producing what sort of different typologies will be suitable. But Generic Kojima, our joint venture partner, also critical to this. They've got a lot of knowledge from other areas of the country. But what they're also doing is trying to push the innovative housing line. So they've appointed 3 specialist architects they regularly work with to really push the boundary about what the residential typologies can be on CAV and how we can try and change the housing market a little bit. And that'll hopefully inform the later living complex as well, working with the partner there.
No, I've got in. Yes.
Oh.
Don't know.
Oh, hi, Jeremy. I think we can hear you.
Hi, sorry,
yeah.
Yes, I am back in.
We were just going
major outages.
Yeah, it's the same as WhatsApp this morning. So, yeah, we were just going through some of the questions asked in the Q&A box. So we've answered one from Alison at the bottom. I think we've had a few more since. I don't know if you wanted to go through some, or if you had some of your own.
Well, I fortunately I have listened in, but while I was on my mobile, it was cutting in and out. But Ian and Robin and David, thanks for those presentations. I think there were a couple. There's one from Wendy. I don't know whether I saw one from Wendy earlier. I don't know whether you've responded to that one yet.
No, we haven't. No. So this one's: can you signpost us to the research that you've mentioned that demonstrates the benefits of intergenerational living to healthy aging? I think that question was directed at Ian.
Yes, we can. Not off the top of my head, but I'm more than happy to share some links with you so that people can browse those at their leisure.
Yeah, we can upload that to the website as well alongside the recording.
Sally, I would suggest whoever posed the question, Google Humanitas or contact me or Robin. We can have a conversation about Humanitas, because if you can make contact with the director at Humanitas, they'll speak volumes about the benefits they've had from intergenerational living on that particular development.
Yes, and David, I think I remember rightly that the original HAPPI paper that was prepared by Lord Best, they visited Humanitas in Holland as well. So
Yeah.
I remember that there's a good link there around sort of the health and well-being aspects and better intergenerational living as well.
Fascinating.
Mm. I'm afraid I can't get the Q&As up in my chat box or my footer on my screen. So I don't know how, Sally, if you're able just to plough through those.
Yeah, of course.
I
So
could on
we've
my
had
phone, ironically, but
we've got one from Lois Beach, a colleague of ours. Have you had to provide either the social or economic value that might occur as a result of co-locating housing, health and social care services as part of a business case? It would be useful to see this if so.
We haven't had to, but we have done it. Robin?
We've had an initial study done a while ago, but it wasn't the level of specific numbers because we haven't got to that point with the master planners yet. So what they prepared was a toolkit which we can use, and we input the data as we're going along and refining the master plan to understand that the market suggests there'll be 150 units of later living. Once we start getting to that level of detail, we'll work out the outputs in terms of the social impact and obviously cash benefits, as well as the research outcomes, which is critical for the university.
Yeah, we've also had an initial piece of high-level work done by
Ortis.
Yeah, Ortis, that gives sort of, and it was very early days based on the speculative development of the site, but that gives some information which we can share you a sort of summary of. But as Robin says, we're getting this toolkit to, as the site develops, to develop what might be the social and economic value. But we've got indicative social and economic value from the Ortis report.
Great, thank you. Moving on, we've got one from Julian Brewer. Thank you for your question. Really keen on a mix of retirement support and multi-generational living. How have you kept all parts of the community actively involved in shaping the plans as they have been developed?
We haven't got to that stage as yet. That's what's going to be, once we get a later living partner on board and they start working, that's when we'll have a lot of community involvement. At the moment, we've set the strategy and we're going to focus on setting up a community advice group. And that'll probably be from local community organisations we've already been in touch with. For example, Greening Wingrove is very, very passionate about the area and the green public realm that we're going to deliver on the site. So we'll be working closely with them and a range of other organisations to create this focus group, if you like. And then as each design or concept, even the naming of the site, we'll be engaging with the community to take it forward. But we're still very early in the master plan setting stage of the development, not to the detailed design of any type of facility on it yet.
But as I mentioned in the presentation, Sally, we have been engaging with the local community right the way throughout the process, so that won't be a cold start. We've already got very strong links into groups like Greening Wingrove, the local ward councillors, etc., etc. So the work that we did initially with GSS, our master planning architects, and then taken further on with the work with Urban Foresight and our university engagement team, Andrea Henderson and her team, we have got strong links into the community already. It's just with regards to that later living work, that hasn't started yet.
Okay.
The other thing which excites me about this is that Newcastle's always had a strong presence around age-friendly communities. And as one of the sort of first, sort of along with Manchester, sort of cities to adopt that, and working closely with local community groups. So, and especially now with the Innovation Centre for Ageing, it seems like your partners there, you've got the real good nucleus of taking this forward.
Yeah, well, I mean, back to the research element, the facility, the existing facilities on the site, the Campus for Ageing and Vitality, and some of the key people on that site. And in particular, I can never get this the right way around. I can't remember whether it's Dame Professor or Professor Dame Louise Robinson was the instigator of our submission for a National Innovation Centre for Ageing, which was obviously successful, and that's now based in the Catalyst with Nick Palmerini, who we managed to poach from Boston, a crazy Italian who's lived in America, now in Newcastle. Who's taken that innovation forward, and Lynn Corner, who's the director of Voice, Again, that sort of community engagement through Lynn and the Voice team, we've got really strong links into that ageing community and the ageing research. It's a fantastic opportunity here with the CAV site to just take that to the next level.
Yeah, no, I agree, Ian. Yeah. Sorry, Sally, I interjected there.
Yeah, no problem. I'm just seeing which ones we haven't asked. So there's one from Mark. How have you formed your current design team? Project manager, architect, planning consultant, etc.
The master plan. Oh,
Sorry, you go first, Robin.
Cheers, David. There's a range of things. For the master plan, we carried out a public procurement because of the university, and GSS Architects were the successors of that with Cundall's and Gillespie's underneath them. We haven't got to the point of appointing project management teams for individual developments as well as architects going forward. It'll be a range of options depending on who's carrying out the actual development on that site. So, for example, if the university is developing our first building, we'll be carrying out a procurement process, most likely using our existing frameworks, but we're working with our procurement team on that at the moment. So, David, do you want to add?
I was just going to say, in relation to later living, when we finalise the brief, we've got to hit this sweet spot between not being too prescriptive to stifle innovation, but being prescriptive enough to give people a good idea and a good framework that we want something special. It's up to them to really interpret that brief, and it's up to them to amass their design teams to, come up with those solutions.
I think that the key thing there, David, was your point about, yes, there'd be a land agreement, a land sale agreement, but there would also be a research agreement. So that's our level of intervention, really, that we would need to make sure that this wasn't just excuse the old-fashioned language, an old people's home, that it was an innovative later living development that would work alongside our research teams. And that really would be the level of sort of influence that we'd really want to have. We would expect the later living partners really to have a relatively free rein on the design and development of whatever facilities that we're bringing to the site. In the same way, working with Generate Kojima, as Robin said, they've already started to work with architects that they're familiar with to look at innovative housing developments. We haven't stifled that. We have got no intentions of.
Well, again, I think that's really interesting from my perspective as well, because what you seem to be demonstrating is not just a knowledge economy around the university, but also really how you get into the meat of the economy generally around sort of aging, health, lifestyle, and building that in the ecosystem around that. A really, really interesting program there.
Yeah, absolutely. I mean,
the size and scale.
When we set out with this site, we knew we couldn't develop it. We couldn't develop what the vision for the site on our own. It was a multi-partner approach, and the emphasis being on partner. It's not a case of flogging off a plot of land to a developer to develop. It's around partnering around the vision.
Yeah, no, absolutely. Sally, I've managed to get a couple of questions up. I see there's one from Barbara, hello Barbara, it's lovely to hear from you again. And she talks about a Newcastle neighbourhoods group, which is part of the collaborative Newcastle, and again, suggesting it may be worth touching base with them if you haven't already done so.
We can check with Andrea to see whether her team has, but if not, we can certainly pass on the information. If she would like to pass on a contact, that would be tremendous.
That's great. Were there any others that I've missed there, Sally?
No, I think the rest of them are more so comments, because the chat box was down, but I'm more than happy to share this with everyone following the webinar, but I can't see any other questions at this point.
Well, it sounds like there's been more than one technical hitch this afternoon. I do apologise that it took me half an hour to get in. I don't know if you realise, I did listen in for a little bit. So, Ian, I did get some of your presentations, but watching the screen at the same time wasn't as easy. But are there any sort of final comments that you three would like to make?
No, just from me, just thank you for the opportunity to share our vision with a wider community. And just take comment and feedback on what people feel about what it is that we're trying to achieve. Robin?
No, exactly. That's just, if you're willing to be engaged with it going forward as well, please just get in touch. We're more than keen to discuss the project, and obviously a few years down the line you'll be all learning about the outcomes, hopefully.
David?
Just to reiterate what Robin and Ian just said, really, the engagement, we can still engage up until we go out of tender, but that's a good few months. So let's keep that engagement process going with the HousingLIN, yourself, Jeremy. Potentially you could come to the working group on a visiting basis. You're offered to be our constructive friend, not critical friend. We'll take you up on that. But also any comments that come back, we'll certainly look at them, and if we can engender some further conversations with the relevant people, we'll do that. If that helps develop something special on CAV, then by all means we'll take a look.
Well, I'm sure it will, but also some of the lessons from other locations and localities across England, Scotland and Wales. I'm thinking some of the things like the healthy new towns, some of the work that's been done in Exeter, for example, or in Ebbsfleet would dovetail quite neatly with some of your thinking. So, you know, we are a learning network. We look forward to sort of sharing that information, knowledge, and, you know, so that we can all improve. And, you know, obviously you're going to put this from the drawing board into practice. So, you know, we wish you every success, and we look forward to following you.
Thank you.
Yeah.
Thank you.
Well, look, I'm conscious that we're slightly ahead of schedule. Sally, if there aren't any other questions, I don't know if you could have just a quick look in the box. I thought we might like to draw to a close because, again, I know, Ian, you were under pressure for time this afternoon. So thank you very much for shifting things around to be with us. On behalf of the HousingLIN, are there any other questions that are coming through?
No questions, just a couple of nice comments. So one from Wendy saying, just wanted to say it's fantastic that you are all obviously so genuinely excited about this project. Good luck, and looking forward to the launch party.
Well, it'd be lovely to do this in person, Wendy. You're
absolutely
right.
Thank you, Wendy.
Well, look, as I said, on behalf of the LIN, thank you, three of you, for joining us this afternoon. Apologies from me personally for struggling to get in, but it was worth it. Definitely worth it in the end. And as David said, we look forward to participating in various ways in the coming months and years. Sally, thanks ever so much for putting things together behind the scenes and while I was struggling to get in. For those of you who may have only joined us for the first time today to hear this excellent presentation, we actually try and run a happy hour once a week on a Tuesday. But in fact, next week we've got two available for you. The first on the following Tuesday, this coming Tuesday, is with our friends at ADAS East of England, where we will be putting the spotlight on a recent report they have produced on why it's really important to connect housing and social care, and drawing on the lessons of the region in a recent report that they launched. And then on Thursday, if you've got some more time on your hands, please do join us for an extra special happy hour that we're squeezing in for the first time. I think we're doing 2 in 1 week. And this one is with the Local Government Association and follows a report that the HousingLIN was commissioned to write for them on their plans around housing for ageing populations, and putting the spotlight on 6 localities, 6 local authorities who've been doing some fantastic work around their strategic plans. So again, do come back to us on Tuesday and Thursday of next week if you haven't already booked. But on behalf of everybody here at the HousingLIN, thank you, Team Newcastle, for joining us this afternoon. It's been a real pleasure to showcase your work at CAV, and as I said, look forward to doing more showcasing of that in the coming months.
Thank you for the opportunity.
Thanks, Jeremy.
Thank you.
Thank you all.
Thanks, Sally.
Thank you.
Bye.